What's up, everybody? Sean here with another Live to Roll Live. So, this week we are going to be getting into a little bit of a stinky topic. We're going to be talking about bowel care and all the different options and just bowel management and stuff. Yeah, we'll just get going here. My name's Sean. I'm a C5, C6 quadriplegic from a snowboarding accident 17 years ago now. So, Tom, you want to give yourself a little?
Yeah, I heard Sean was over here talking shit, so I had to come over here and, I'm just kidding. There's gonna be a lot of those terrible puns today, just, FYI, everybody is listening. I'm Tom Conway, C5, C6, incomplete quadriplegic for the last 24 years. I'm 28 years old, and yeah, live down here in SoCal, doing my thing, and toss it on over to Bobby.
Hey, Tom, I know you're always talking crap, so don't worry. What's up, everyone? My name is Bobby. I'm a C56 quad as well. I was hurt almost 32 years ago from a cycling accident, and great to just be here. And I'm going to move it over to my lovable, adorable, good friend, Louie.
He's our big
Hey,
teddy
everybody. It's great to be here today. My name's Luis. I'm an L3, L4, incomplete, so I'm very low level, kind of behind the belly button. And I've been injured for 40 years as of last week, had my 40th anniversary. And,
Congratulations.
It's good to still be here. Everything's still functioning.
That's good to hear. 40 years is definitely that's a pretty big milestone for sure. So that's cool.
Luis, since you're our guest of honor today, I want to get you started, get it started off. Since we're talking about bowel management and bowel care, I'm just going to put you on the spot. Can you tell us how you do it as a para that's been doing it for 40 years?
Mm-hmm. Well, essentially, I don't use any of the usual tools that those of us with spinal cord injuries use. I don't use magic bullets. I don't use laxatives and things like that. I use a technique that I was taught in the hospital called straining. And specifically, there's two types of straining. Crede, which is where you use your hands just above your bladder area, just by your stomach there. And then Valsalva, which is to use your core muscles right in here to strain down with your stomach. And by doing both of those kind of alternately or together and with certain breathing, you could push your muscles in your stomach to create pressure to push your stool out of your bowel. And sometimes it works pretty quick. Sometimes it takes a long time. So that's when you use this technique, it's really important to keep your stool at a certain consistency. So you don't want it too hard, not too soft, but definitely not loose.
So that's where nutrition and a balanced diet comes into play.
Exactly. So you want to use your nutrition, the food that you eat, supplements you might take, certain medications can make you constipated. So if you take those medications that make you constipated, then you want to counteract that with something that will soften your stool, not necessarily make it loose, but softer.
And I know, it's pretty well known, but painkillers, narcos and things like that are very, very common. Like the constipating medication that a lot of pairs and quads take for pain management things. So it's something to know if you do struggle with that, you're on those medications, something seriously talk to your doctor about because there are things that they can give you to help combat those negative side effects.
Exactly. And when you take so many medications, not just us as people with disabilities, but also seniors run into this a lot too with constipation and bowel issues because they take so many pain medications and things for arthritis, which I do have arthritis. There's ways to change that. And like you mentioned, the medications, myself, instead of taking pain medication, I take magnesium and potassium. and this helps me with my cramps and the pain spikes that I get, but it also helps me with my bowel.
And
So
magnesium is a natural supplement that can stimulate your bowels. Like it's very commonly given to individuals that are seriously backed up. Like I know that it's common for quadriplegics because we're sitting often and not moving around too much. I do experience some dysmotility. I mean, like I
mhm,
have a pretty consistent bowel schedule that changes. It seems like every few years, which is another big
yeah,
part of it. Kind of staying active on managing it because it's not always going to be the same. And if things aren't working, that may be like the sign to you got to try something different. But
exactly.
the magnesium is what I've used in the past, like magnesium citrate or something. If I just feel backed up, if I know that like I'm having a lot of accidents and I think that's the reason why, is I'll take a day and I'll like take a heavy laxative, usually something seriously magnesium based to help stimulate it. And it's not a fun 12 or 24 hours, no doubt. It's kind of something you gotta hunker down for and just deal with and like arrange your care accordingly. But I've noticed that it's something that happens to me every 6 months, once a year, like my body gets a little bit backed up. And it could just be from certain foods and things like that. But whatever it is, and it may be also part of the quadriplegia. I know that the higher level paralysis, the more common you experience something like dysmotility, which is just a
Mhm.
slowing down of your body's natural peristalsis, that natural movement of food and digestion. When you're sitting and when you're not moving around and jumping up and down in that motion of standing up and sitting down all the times, things just slow down a little bit. And the longer you're paralyzed, kind of the worse it tends to get. But
Yeah.
it's just something to take note of and be conscious
So
of.
I actually never really like I need to actually start keeping better track of stuff like that, but like you said every 6 months or so you have an issue because I do same thing like a couple times a year, once or twice a year, I will have I'm doing everything the same and normal, but all of a sudden I will
Yeah.
get way backed up and just like it just things don't work. Like even right now I've been having issues like where things just slow down and whatever it's harder. So I'm gonna have to start keeping track of like when that is and yeah, if it is kind of
And,
like
and seriously, what I've done in the past is go to Rite Aid and get 2 bottles of magnesium citrate. They're like 12-ounce glass bottles. And just suck those suckers down, and it makes me cramp up and my tummy not happy. Like I said, for you want to like make sure your day is clear, and like the next day you don't
Because
like have to be out.
also, Sean,
right on.
you say you're doing everything right, but even if we're like eating the same stuff, eating right, it could even be where it could be weather change, pressure. So it could be the way you were active one week, for a bunch of times, and one week you were not. So there's so
Right.
many different variations. But I bet you a lot of it would be during the summertime and during the wintertime. I bet you would see some kind of spike when weather changes.
That
And
makes
it
sense.
it all I'm sure has to do with our body adjusting. Like changes in diet. Gradually over different seasons, things come into season and stuff. I mean, I know I like my spicy foods, but we also have to be very conscious. Our gut biome is super sensitive. There's a whole, living system that helps manage our digestion and the breaking down of food, and eating fast food, eating, like very processed foods consistently without eating, veggies and the organic stuff, tossing some yogurt into your diet to help keep that
Yeah.
gut biome healthy. Because if that gets out of balance, that can be a cause too, where it's just your the bacteria is out of balance, which it can cause loose stool, accidents, diarrhea, and things like that. But there are lots of supplements to help keep your gut biome in balance as well. Luis,
Also, one of
go
the
ahead.
one of the major key ingredients, water, water, water.
Yeah.
Yes.
You want to make sure you're getting a lot of water, and our body is made 70% of water, and that's what's going to help us keep us flowing. It's not going to if we get dehydrated. Guess where that water it goes out of the colon first.
Yeah, I mean, I don't want to like get too like scientific or medical here, but the way that your intestines work and stuff, like with the goblet cells, the mucose production and stuff, it's all a part of like being hydrated and like a healthy balance system. And if one part of the system is out of balance, it may not even, like Bobby said, be food related. That could be, a big part of it. If you notice you're chronically hydrated and your pee is like a very dark color, consistently give yourself, a day to just chug some water and, really try to rehydrate and see if that makes a difference.
Yeah.
Well, it's like
Well, wait here.
warm water works best for him. Like, especially right now, I'm drinking so much warm waters. I'm having more soups and stews, that the white have changed a little bit. And everything is just flowing like great. And I notice in the summer, it's not as much. I'm drinking not as warm water, sometimes colder water. I'm not eating more, type of food with fluid in it. And you can just tell the difference between my winter and my summers. It just, winter's flow is so much easier. Even though I'm more cold all the time and tensing up, but God is always working a lot better for me.
Something I wanted to mention about the supplements, such as the magnesium. There are different types of magnesium. And so people always ask me, well, what brand do you take? And I say, the brand I bought this month. Because I constantly change up the different types of magnesium that I take. I don't take the same thing all the time. Where if you take the same thing all the time, your body might get accustomed to it. Or after a while, your body's just like, I don't like that. So it's a good idea to change it up a little bit, stay within the same family of supplements, but instead of one type, try a different type. And if that works for you, great, use that for a little while. Go through the bottle. The next time you change up, try a little bit different type. Try a food that is high in magnesium, not just the supplements. It's very important to use supplements, but use diet and food interactions as well.
Yeah, definitely.
What is your diet like, Louise? Do you stick to 3 meals a day? Is it like veggie based, meat based, fish? Like what are you eating, and how
But
often?
for
Just generally.
myself, I eat a pretty normal diet. I try and eat. I studied nutrition in college. I had a year of nutrition, and the key thing was to eat a balanced diet. They talk about the food pyramid, which is old school, the four-way block of foods that you should eat, and every couple of years it changes. And so when we start eating and putting this stuff in our bodies, it's important for us to notice what we're putting in, especially when you're new injury. Keep a journal. Notice what makes you loose. Notice what makes you constipated. Um, this is going to sound really bad, but look at your stool every day. Every time you have a bowel movement, look at your stool and look at the color. Notice if it's because of our paralysis, we may not be able to feel how it's coming out, whether it's firm or stiff. And stiff stool is a problem. You can have issues. So you have to keep an eye on it, keep a little journal, and the next day when you eat something, the next time you have that bowel movement, notice the difference. If there is a difference, write it down.
So food
Keep
journal
track.
is always something I recommend. Something that I like preach a lot, but don't do myself too often. Like I always get in the habit of trying for a couple days, and then I end up losing it. But yeah, coming to an understanding, like a serious understanding, consistently over time. Really, only one way to do it is to track it. Like I've
Yeah.
noticed, it's really only super important when things are out of balance for me. Is kind of when I tend to, and it's just something that like helps me get back on balance because like whether or not I change too much in my diet, I'm conscious of it. I'm more conscious of what I'm eating. I'm more mindful of the things that I decide to put in my body. Like I get lazy. I love my cheeseburgers and stuff.
Yeah.
And that's like a big part of it. But also setting yourself up with healthy snacks. Like I got my kind bars sitting on my pantry, to like chow down if I'm feeling a little low or something instead of going for fast food or something like that. But that's a big part of it, I think, is tracking it.
I hear you because I'm really bad about that myself. We talk about in some of the Facebook spinal cord injury groups every day. There's somebody asking the same question all the time. What medication do you use? What do you use? What do you use? And I get tired of answering the same question all the time. I just give the same answer all the time. Tacos. That tacos are my medicine. Of course, I make sure they know I'm being sarcastic, but it's true. I do eat a lot of tacos, but I
Yeah.
also eat a lot of vegetables. If I notice that my stool is getting loose, I'll I'll change up that next day for breakfast. I'll have some eggs and some cheese because it works as an emulsifier in your body. It's like baking a cake. The way to get a cake is to rise is to add eggs and things that will emulsify, bind that stool together. And literally, I change what I'm going to eat that day. I might get to dinner time and realize I need to eat something that will soften or firm my stool. And I'll just change it right at that meal because I know the next day I need, to do one or the other to get the result that I want.
Um, yeah, no, absolutely. I mean, I definitely like depending on how I'm feeling. I've learned just from paying attention to my body, experiencing enough accidents and issues and problems, and like really paying attention to how I'm feeling. And this is just like coming from experience, like years and years and years of experience and feeling how my body is, and like just learning it. And it's something we all need to do. But yeah, absolutely. You make small changes. If I know like I I'm likely going to have an accident, I feel like I might, I will only eat really fibrous foods. Like I'll stick to breads, potatoes, like things that are like
Yeah.
bulky, things that aren't going to, cause me because sometimes, I mean, it'll just like, I can eat one taco and 20 or 30 minutes later, that's all I needed to, like cause me to have an issue or to, make that happen.
Yeah.
But it's all part of planning and preparation, which
Yeah.
is a big part of it. For as a quad, especially, I'm gonna shout out our quads for a second and just talk about my routine. We had a couple comments. I wanted to touch on those. The enema systems that were used. I think Crip Life mentioned the enemies, and then Peter says he's on the Paracine system, which the VA hooked for him, which both are awesome. I used the enemies for like I think 7 or 8 years to great success. It was all I needed. I had very few accidents. It was super consistent, and it was a daily program that I did. I got up every day, did the mini enema, like did my thing for 20 30 minutes, showered, got up. That was my routine every day. Then I turned like 18 or 19 years old, and something changed in my body, and I had to change it up. I was having very consistent accidents. And what I ended up switching to was just a regular fleet enema. My solution was like, just needed more to get up there. I wasn't evacuating enough. The mini enema wasn't enough. And I would have the accident always consistently a few hours later. Switch to a fleet enema, no problem. Same thing, daily routine. Get up every day. That was the start of my day. I would cath, do my bowel program, shower, dress. That was just, takes about an hour and a half, and that is just part of the routine. And recently I changed that. Recently I've cut back the number of days that I was doing it, mostly for independence, like personal reasons. It's very hard to always wake up and first thing you do is like have your caregiver and have to spend an hour and a half or 2 hours dealing with your care. I need a morning or two or three a week that are my own. That and it's important
Mhm.
to me that I was willing to change up my system and change up my care. And it's been a little up and down. It's been accidents and trying different things and figuring out different stuff. The regular fleet enema isn't really working with like the every other day routine I try to switch to. So trying like 2 days on, 1 day off, 1 day on, 1 day off. I'm just switching it up and mixing it up. But the other thing that I wanted to talk about, which is I also have it too. I don't have the insurance approval for the replacement supplies. It's made by Coloplast, but it's the Paracine enema system. and it is just a higher volume enema. It's reusable. The rectal catheter, the part that you just like go inside you, those are replaceable, meaning like you're supposed to reuse it every time. I've
Hmm.
talked to several people. They're very washable. They're plastic. They're not necessarily. You don't have to if you clean them and stuff. You don't have to reuse them every time. But if your insurance approves and you can afford it, then definitely. But I know that that is something that some individuals have done that use it and have issues with the insurance getting the necessary supplies. It is somewhat reusable, so that's very good. But what it is, it's just a higher volume enema. The rectal catheter has a small little balloon on it, so it's almost like a Foley, and it just holds it in place for longer while the enema is administered. I think it's like 5-10 minutes or different settings, different ways you can do it. But the point is that it's supposed to be a bigger clean out. It's supposed to take a little bit longer, but it's a higher volume enema, so it's supposed to get higher up. And if you have issues with accidents following your bowel program,
Yeah.
that is generally the issue is you're just not evacuating completely. And it can be difficult. Everyone's body's different. It's something that I struggle with. That can be part of my diet and just the consistency of my
Hmm.
stool and stuff that can be causing that, which I constantly try to play with. But as far as an effective system that can help treat that, the Parastene is really solid. And it's gotten a
Hmm.
ton of good reviews and is being really pushed by a lot of like hospitals and agencies I know. It's just getting anything new in the insurance system is difficult. So
Yes.
that can be the hard part. But definitely a very viable solution for quads or paras who are looking for enema based system that is a little bit more effective. There's been lots of good words from that. And I know Peter says that he has really high effectiveness with it. So that's at least one crip out there who's shouting it out.
Yeah, I've actually
It's
met a
really
couple people
important
that use
to
it.
know those products, because the right enema system can make all the difference for somebody.
Absolutely. They can be very like intimidating and weird too. Like a lot of people are not comfortable with enema. It's not something like easy to talk about. Like honestly, none of this stuff is super easy to talk about. But I've noticed trading caregivers, getting caregivers, especially from agencies. They're coming in, they're like, "You want me to do what now with an enema?" Or like, "What?" They're like, "I thought this was like vitals, making sure your skin is okay." It's not like necessarily bowel care. Um, I always like make the joke like I could train a monkey to do this if like they have the dexterity to do so, and like the patience to wait for me because it really is so simple. But that's really up to the individual learning your care. I always tell everybody I talk to, super important. I cannot perform my bowel care, but I can blindfolded tell someone what to do and how to do it because I'm like that intimate with what needs to be done and how it needs to be done because I made a point to learn and ask questions and to pay attention.
Yeah,
And
that is
that,
so
I think,
important.
Yeah.
Exactly what you're talking about is even when you can't perform it yourself, that when you come out of rehab, you have the skill to explain to someone how to do it for you. Because that's having that ability to have one caretaker do it at night and another caretaker do it in the morning. And if for some reason you don't have your regular caretaker, you have to be able to communicate and explain, this is what I need, this is how I done it. And of course, once in a while, you're going to have a caretaker who says, oh, I know what I'm doing. I know how to do this. But you
oh
have to
yeah,
be able to explain, hey, it's my butt, not yours, and
exactly.
say,
It's my care. There's nothing wrong with that. I mean, like, hey, I know you've done this a certain way a million times, and if it's cool, we talk about it. I want to try something different. That's great, but here's how I do it. Here's how I want you to do it, and that's just the bottom line. There should be
exactly.
no argument or nothing more than a conversation because you are in charge of your own care, no matter what anybody says. Like we all are masters of our own body, and it's easy to forget that sometimes in our situation.
Yes.
How about you, Sean? What's your go-to system?
So my routine, and I'll actually pop up Mason's comment because he's talking about using a magic bullet, which is what I use. So I use suppositories, which is what I've used pretty much the entire my whole time. I have tried a couple things. I've tried the enemies. For a few months, I gave it a go, and they just for some reason didn't work for me as well. I wasn't getting like good full evacuations. But So I use magic bullet suppositories, and I do every other day. So that's pretty much. I used to do for a lot of years. I did Monday, Wednesday, Friday because that helped with like rugby travel and everything like that. So it allowed me to have easier weekends off. But after a few years, I really noticed that the Mondays were getting harder and harder and harder after like skipping the 2 days. And just it became to the point where like Mondays would just become like my whole day was it was spent in the bathroom and then like blood pressure like recovery after the bathroom because it was just such a
Yeah.
struggle in there the whole morning. So like yeah, I'm doing every other day now. And then my other thing is, so I do probiotics also, like Luis mentioned before. And then I also, a couple of years ago, I had, when I first moved actually, and I'm sure it was partially because of the stress and then just everything going on with moving from my house out in Rancho or out in the valley out here to Rancho. But I stopped going to the bathroom for almost 10 days. Like, I could not get anything to come out. And it was honestly scaring me. Like, my stomach was like, you could literally see the visible, just like, it was big. Like,
Yeah, you're usually impacted. Yeah.
it was really bad. So I ended up Megan Blanc. I don't know if you guys know who she is. She's a Paralympic basketball player. I follow her on Facebook and stuff like that. She had mentioned having issues, and I saw one of her posts about constipation. She tried this. It's called Dr. Scholl's, not Scholl's like the foot thing. Dr. Scholl's. Intestinal formula number one. And if you just search intestinal formula number one, it comes up in Google or anywhere. So I ended up taking one of the pills, and the next day I felt like it really was trying, but I couldn't get it to go. So the next day I tried it again, and I got some, and then I went the next day, and then basically like couldn't stop for a week after like a few days of these pills. So now my routine is a probiotic the day before I do my bowel, and also I do those pills were so strong I ended up opening them up and breaking them down into 3 pills from the 1 pill, so that I literally take a third of one of these pills the
Yeah.
day before each of my bowel care things. So like that's my kind of routine now. I've been doing that for about a year now, and it honestly has worked pretty well. Like my bowels are pretty regular. I do have rough days here and there, which maybe diet, stress, I don't know, just different things I'm throwing in there. Weather
The only
even like
the only
so.
supplement that I take is like Benefiber. It's like a wheat dextrin fiber I get at Costco. Like the Kirkland brand is the same thing. Save a few bucks and get it. Benefiber is just also the name brand, but it's wheat dextrin fiber. That's the stuff that I get, and I just put a tablespoon of it, like one adult serving, in with my cup of coffee I have in the morning. Like we have on here to talk about foods that can be trouble. I love my coffee. But coffee can be trouble. Everybody knows that. Who's had a strong black cup of coffee, and that can get things moving pretty quick.
Coffee does it for
Now,
me.
I always do my bowel program in the morning, so it's really easy. Like I'm like, right, I'm clean now. I'm good to go. I can have my cup of coffee and usually be fine. But I've noticed that if I mix the fiber in, which it just dissolves, I don't even taste it. It helps keep my consistency good. It keep my stool a little bit not so loose, which is kind of something that I struggle with. Is that right consistency, but that daily dose of fiber. I don't do my veggies as much as I should. I try to eat more green. I got people in my life telling me I need to and feeding it to me. I try, but I don't always get as much like veggie fiber and stuff that I need to. And the wheat dextrin helps supplement that for me in my terms of you know creating the consistency. And
Yeah,
then
that
I
cup of coffee will put me on the toilet for 3 days with a blanket and a pillow.
So coffee is
I
another thing
cannot
for
do
me
coffee at
too.
all.
But it is also something that I know has been incorporated in some people's routine. they will get up and have a cup of coffee an hour before they do their program, and then that really helps get things moving. And heck yeah, that's awesome. Like if that works, then that's just part of it. And like I love that balance, and that's cool. And I think you just got to find a way to make that balance, because I like am not fun without my morning cup of coffee, and I love it. So it's something that's important to me to try to incorporate it into my system, into my routine. Because it's just
Yeah.
not worth it to give up those things that make me feel good throughout the day.
See,
And I
you've
want to
got your
shout out Crip
coffee, I
Life.
got my tacos.
Yeah, there
Yeah.
you go. I want to shout out Crip Life. He said, "Hit that like button." Everybody out there, make sure to smash that like button. Thanks for the shout out, bro.
Heck yeah, yeah.
And
Thanks.
yeah, I did want to touch on we have
We
someone in
should.
the comment, massage therapist mentioned when they were CNA, they did the bladder and bowel care. I've had RNs that have come in and had absolutely no idea how to operate a Hoyer lift, how to do an intermittent catheterization through a stoma, or like to do my bowel program. And then I've had CNAs that have come in and like they are so competent and skilled. It's just absolutely astounding.
Mm.
Like there's so much more experience and skill than the RN in some circumstance with certain types of caregiving and stuff. It's just a mixed bag. I think it depends on the nurse's experience generally. I only have an agency caregiver come in 2 days a week, because that's all the insurance will pay for. And it is kind of odd care the way that they do it in California. The nurse who performs the bladder and bowel care isn't allowed to do your shower and dressing. So they actually have a LVN or an RN come in for an hour, and then they trade off with a CNA who helps me shower and dress, which usually only takes about 30 minutes. Um, but my insurance pays for that 2 days a week, and it was a fight. It took 6 months to get them to approve that, and now I'm so afraid to let it go that like they're gonna say you're stuck at 100 days again. Like that's it. So that may not be available for everybody, but if you fight for it and prove that it's a chronic condition that's not going away and that you require consistency in your care, because you could end up septic in a hospital with impacted bowel and all this other problems and crazy shit. Like that's just what you got to do. But the rest of the time, I manage it through in-home supportive services. I have a caregiver who is actually a CNA at hospital, so they do work in the hospital environment. But in-home supportive services is a program here in California that if you apply and are approved, with the right, doctors and notes and stuff, they pay for and approve you for a certain number of hours of caregiving a month. And that's how I supplement the rest of my care. So it's 2 days a week. It's done through an agency. And then the other 2 days is done through my home supportive services caregiver. And that is 2 or 3 days, depending on how I'm feeling that week. My guy's awesome. And I just tell him, like, if I want that extra day, I'll just text him the night before, like, hey, I don't need you tomorrow. Like, we're good to go. And, like, he's good with that arrangement and, like, it works for us. But it's, pretty much always at least 4 days a week and then a supplement as needed.
So
But
let's hear from Bobby, and because Bobby has done everything and now made a change in his life. So let's uh let's let's hear
yeah,
Well,
your situation, Bobby.
like I said earlier, I've been injured almost 32 years. And I started off with magic bullets and used them for 30 years. I was like you, Sean, Monday, Wednesday, Friday because of rugby or traveling for work. It was always, or because sometimes I would do it Thursday, maybe afternoon or night because I had to either take a plane ride out on Sunday night, or I mean Thursday night, or early Friday morning. So it was like I got away with it for a while. I was one of those guys. Drink a cup of coffee. Drink a cup of coffee during my bowel program. It made it go so much easier. Magic bullet. I was one of those types that no matter what happened, it just took 2 hours. It was a 2 hour ordeal. Uh, the first hour, everything goes great. The second hour, it was you got to wait around because something's going to happen in 45 minutes.
That's
It
neat.
was no matter what. And I've had a couple of nurses when I've traveled, and I'm teaching them how to do it on the spot. They're like, "Oh, you're done," and I'm like, "No, I'm not," because if you say I'm done and I get up right now, we're going to have an accident. And so it was just 2 hours. And then about 3 years ago, I just started having problems. I started doing what you did, Sean, going more often, almost every day. And I just felt like I couldn't evacuate. I was still eating the right same foods, doing supplements. It would just be like I would evacuate and then an hour later feel like I'm bloated again. My stomach was holding a lot of air. So finally, I just, the pain and the discomfort was so bad. I just said, maybe my watch is going up. Maybe I need to look into a colostomy. It would save me so much more time in the morning because I always did my routine in the morning. And finally, one time, I went to go see a doctor, talked to the doctor, and he's like, it would probably be a good choice for you. It would save you a lot of time. It sounds like you're having a hard time. And plus, I was starting to get those hemorrhoid problems, some bleeding that went along with it. And I just needed to make a change and something easier. And so I went and got a colostomy. And it was probably the best decision I ever made. Now I don't save 2 hours in the morning every morning. It flows a lot better. I don't get backed up anymore. It's weird to have something that you look down and there's the bag and there's what's inside, but it's easy to change it once or twice a day. I couldn't ask for a better system now. And it's one of those things that I wish I would have went to 10 years ago or maybe 15 years ago. And now, especially when COVID hit, it was, I had an aide come in to help me shower and stuff like that, and especially with my bowel program back in the day. And now we don't have an aide coming in, so, now I don't have to rely on my wife through my bowel program. And it was nice, that it was easy to change myself, or she changes a lot. And, I'm good to go in the morning, in the shower, done. It takes now 5 minutes.
Yeah, that's cool. I mean, yeah, I know. From every time I've talked to you since it's been something that you've been happy with, and
Yeah.
like that you move forward on. So that's cool. I'm still,
For those
you know,
that worry about attendant care or worry about someone coming into their home, it is a good option. Or somebody that has to rely on their wife to do it.
right.
It's not a bad option. I've never done it personally to anybody, but I mean, I don't even mind struggling it. It's not embarrassing anymore. It's not there. I tuck my shirt up underneath it. First time I ever showed anybody. That's kind of weird. I'm not embarrassed by it because I talk about it all the time. And, about 4 or 5 of my friends have gotten it since I've done it. And they're like, so much better. I can't believe I didn't do this a lot sooner.
I hear that a lot amongst people who've had SCI for a long time and fought not making that change like Bobby did. And the most common thing I hear is, why did I wait? I think it's great what you did, Bobby. It's awesome. Because it's going to make things so much more convenient for you.
Yeah, and now I don't get all that trapped air. Like I used to get a lot of trapped air, or I don't know if any of you guys get that, where you just like all of a sudden one day you're like, "Ooh, man, I wish I can fart," and trying to bend over. And now I just did that, and the air comes out just so easily, and it's just nice to get it relieved right away compared to having it all trapped or even waiting a night. Like if you're a morning person and that night you're like, I'm really tired. I don't want to do my bowel care right now. It doesn't matter because this is just flowing all the time.
Yeah.
And it's so much easier on the body and doing what the body was intended to do. Go when it needs to go.
Yeah. I know that's kind of been my biggest issue as of late. Part of changing up like my routine and stuff and like lobbying for more independence is like dealing with accidents when they happen, which not an easy thing to do as a quadriplegic. Now, if you have a caregiver, I was there to assist you, no doubt.
Hmm.
I've been making a journey of, you know, like traveling. Like I just went and stayed at a hotel, like on my own for the first time, like not too long ago and stuff. And I want to be able to do a few days, on my own. But part of that for
Yeah.
me is like to be able to clean myself up and deal with an issue if I have it. And I wanted to just touch on that a little bit because I know it's something that a lot of us deal with. I mean, up until 6 months ago, seriously, like the idea of dealing with it without a caregiver was like not in my head, just because I had tried, and it's so freaking hard, and it's messy, and it takes a long time, and it's just not an easy thing. And I wasn't even physically able to. Like I did not have the muscles. I did not have like the strength to even do it. And that was hard. I mean, that was hard learning and failing and, being dirty and having to like wait for a caregiver still and having to, like just, sit and deal with a mess and stuff. And it was very hard on me mentally, like
Hmm.
we don't talk about it too much, but, we all have vanity. We all care, about how we look and how we appear and stuff. And I don't know, for me, like there's just nothing more embarrassing than like having an accident. Like out in public, around people, like in front of people, around like, my people and stuff. It's very hard for me, and something that I've had to work on and learn how to deal with, and not like totally like mentally shut down on myself. And loved ones close to me would, say that I probably do a pretty shitty job at that because even like still I do. Like there
Yeah.
was just a weekend, like where I had 3 accidents in 2 nights, and I was, dealing with it all, and it like I was fine the first, 2 times, but that third time it happened, I had no energy, and I didn't have like the strength or the will or the mental, whatever to keep on going, and I did break, and I broke down, and it was hard. Like I get cold, I get embarrassed, like I want to push everybody away. It's like, oh, leave me, like leave this embarrassed mess alone, to like deal with it. And it's something that like very has been very mentally trying on me in my whole life.
Mm.
It's just gotten a little bit more ramped up now that I've started dealing with it and addressing it, independently and not having
Yeah.
those helping hands to do it. And as like where I'm kind of trying to get to is, it's not been an easy journey, but like I've made leaps and bounds in progress. Like I can now, totally like take care of myself, clean myself up. Part of like this is learning how to prepare, learning how to make it easy. It's not always like super like wonderful like sleep on a check, especially like if you're sharing a bed with someone or something. But like if
Yeah.
that's like what you gotta do, that's gonna like make it like manageable if like you do have a problem, then it's just what you gotta do. Like set the vanity aside and learn to set the vanity aside. Like I always tell myself like if it was, a matter of like, a family member, like a loved one or something, like it wouldn't matter. It wouldn't be anything to me. And like if that's the case for me, it should be the case for them too. And
Yeah.
getting that into my thick skull is easier said than done for sure. And I
I,
still struggle with it and have been struggling with it. But um, staying after it, staying, after the independence, and every time it gets a little bit easier. I mean, like it took me 45 minutes, like the last time it happened, and I was clean and there was no issues, there was no mess, it was all good, and I was like doing my thing, I was like dressed in my chair, like feeling good for like one of the first times. So, like we say this all the time, just stay after it, stay hungry, stay, work those muscles or getting stronger. And, I'm learning how to do it better. I'm learning how to move
Hmm.
my body, shift my weight easier. One thing too, it's a vanity thing. I'm not a big fan of them. I don't think anybody are, like adults that have to wear them, like pull up, like a diaper or something, right? I know some people rely on them more consistently. Something my mom and dad never had me in. I just did my programs and was very consistent about it. Now into my adulthood, having no experience, wearing anything like that or using them, it was super embarrassing. It was a big, big, big dandy thing for me. But if I haven't done my care in 2 days and like I've been eating and I know there's a good chance that I'm gonna have an issue, if I have one of those on, then I
Mhm.
like go. Then I can manage my care. I can deal with it. If I don't, it's the clothes, the chair, everything. It's just too much of a mess. Like the bed, like there's just no way to deal with it. Like there is no like feasible way I've learned how to manage it. And I still love, wear my boxers 5 days a week, or like sometimes I just always, can wear my normal clothes and stuff. But I've learned to recognize and learn to set aside that vanity, like on the days that I need to, like it is okay. Like it's not something to be embarrassed by. It's just a part of life that, we got to deal with. And
Exactly.
just got to deal with it.
That's one of the things that I do for myself is I always keep a certain amount of supplies in my wheelchair bag, and then I have a separate bag that I keep in the car.
Yep.
So I'll have extra clothes. I always have a complete bag of wipes. You know, what I call Instacork, so that if I'm having uncontrollable diarrhea and I'm someplace out in the public, I can go in and I can pop some Imodium AD and Pepto-Bismol at the same time, which you're not supposed to do. But combined, it will plug you up in a matter of minutes. That's why I call it Instacork. It works, but I'm not recommending you do it. If your doctor tells you don't do it, don't do it just because dumbass here does it.
I tried Imodium one time. I was going for like a weekend in San Diego, and I was like super worried. I fasted for like 2 days before. I was like doing my bowel program like every day, like up into it. And then like I took some Imodium like on the train ride over there. I was like, oh, this will just black me up and I'll be good to go. And of course, I had an accident that night.
Yeah, it happens. It happens.
But I'm a big fan of that, and really want to touch on it again. Preparation, set yourself up for success. If it's a
Yeah,
matter of just feeling secure, have an extra pair of clothes with you in your bag. Have some athletic shorts, just like fold up, even in a bag, inside a bag, if you're worried about people seeing and asking about it or something. But
yeah.
just that security, knowing I got the wipes, knowing I got the extra clothes, knowing I got the stuff to handle it if I need to, takes all that
Mhm.
anxiety and all that fear away, because I would get consumed by it, knowing I was going
Carry
out.
a disposable bag for your dirty clothes, because I have thrown away more clothes in public places.
Luis,
Yes.
I don't know if you want to tell the story. You told it in a support group about, I don't know, a month ago. Being on stage, something
Yeah,
happened.
Oh, yeah. This is one of my favorite stories. It's one of two. So, anyways, you can see on my Instagram name there, it says Game X Bar. I used to be a developer of software for gaming companies, and I would go to the Game Developers Conference in San Francisco. Um, Big convention center. I'm on stage in front of 1,000 people. I'm at the podium, and I lost my bowels in front of 1,000 people. And it was obvious. Everybody knew. Everybody, the panel sitting behind me at the table could all see it. It was obvious. So I had to excuse myself. I had in my wheelchair bag extra clothes, extra wipes, extra underwear, and all that. And I told everybody, I'll be back. I'll see you in a few minutes. And I went to the bathroom, and uh, the the clothes that I soiled went in the trash can. Hopefully, they're still not in San Francisco, because that's where I left them. Um, I cleaned myself up, put on fresh clothes, got all cleaned up, and went back out. And I felt like I owed those people an explanation. So I told them that I'm a walking paraplegic. And yes, I have paralysis from the waist down, but I do have some muscles. What I don't have is bowel and bladder control. And as you saw, I just had an accident where my bowels didn't function correctly, and I don't have the physical ability to hold it if I should have an accident. You know, most of you have working sphincters. I don't. And oddly enough, I actually got a round of applause. Most people were appreciative of my story and the fact that I was willing to go out there and explain what happened and then come back out, resume the discussion, and we finished our talk. And there were only a handful of people that left. You know, there were a few people that were like, "Oh my God, this is terrible," you know, but most people were very nice about it.
Yeah,
Yeah,
you know, that's like impressive courage to do that. But, you know, we are all human, right? We all piss, we all shit, we all got it, you know, we all
Exactly.
do it, you know, in our own way. We just happen to have to deal with it differently. And, you know, sometimes it's not as easy to deal with. And yeah, that's just it. You know, we got a comment, um, two comments I want to touch on. Mason recommends always sitting up during your bowel program. I wanted to touch on that too.
Yeah.
Like huge success for me. Like laying down, things just don't work. Like it
yeah,
is gravity, that natural peristalsis that your body has. Gravity helps with it, and it's important. Stuff digests and moves a lot easier being upright, sitting up. It's just how your body is, you know, kind of designed to get rid of it all.
Yeah.
And then I wanted to touch on Zigzag Wanderer. I know you just got on here. You said that your bowel program is absolutely killing you and it dominates your life. We've all been there, man. At least I know I've been there more than once, and I'll probably be back there again before this is all over. I really recommend rewinding, go back, listen to the beginning of it. We're wrapping up, but there's a ton of good information that you can gather if you're like willing to take
Yeah.
the time to go back and listen, because we touched on a lot of stuff that we probably won't get back to in the last few minutes. But yeah, man, we've all been there. We feel it. I feel you, dude. Just because it's dominating your life right now does not mean that
Mhm.
it is going to continue to. You just have to get in control of it. And that's not the easy thing, man. But
yeah,
I know it's within your power. And we're all here. Got any questions or anything you want to reach out personally, don't hesitate.
yeah,
Yeah,
definitely.
Exactly.
And
Zigzag. If you go back, you'll hear my story. It was dominating me. It was killing me. It was the hardest thing I had to go through. And then once I did this change my life, I wish I would have done it a long time ago to make things easier. So listen back, and you'll hear some great ideas. Some of the supplements and the diets and the things that we have tried and worked with water, food, supplements. It makes a
Mhm.
difference in listening to your body. One thing about Sean and I and Todd, we all C56 quads, but we're all different, and that's how all of us have a different bowel regimen, even though we're the same level and what's going through our system. And I think
Mhm.
with spinal cord, there's no two alike. It's the same way with our bowels or whatever. You can eat one thing, and I try to eat it, and it's just like, nope, not going to agree.
And
yeah,
like my body does give me a warning. Like I call it my 2 minute warning system. Sometimes it's my 30-second warning system, but sometimes it's my 2 minute warning system, and I can transfer. And like it's weird because it's like almost the same feeling I get when I have a full bladder. And it's like,
yep,
nope, that's a different feeling. And then you like race to, go figure it out or, like to handle it and stuff. But, it sounds like not much, but those 2 minutes,
Hey,
just
Tom.
like knowing, understanding what's going on. Like, hey, my body's feeling different. And I did not understand these feelings until the last few years. I've been paralyzed for 24 years, almost my entire life. And it wasn't until the last couple of years that like I really just made a point to pay attention to my body and pay attention to the feelings and like the small differences in those feelings. And I've learned a lot about myself, which has really made this like journey towards becoming more independent possible. Um, for sure.
Well, one
yeah,
of the important things you're talking about, the signals, and one of the key things you got to notice is the gurgle. when you hear that gurgle and you feel the gurgle and it's moving down your stomach and it's like, okay, the gurgle 30 seconds ago was a little higher, so it's moving. It's time to get to the bathroom right now.
And this some of this stuff it is okay to admit, like we are all not able to figure it out on our own. I have talked to plenty of nurse practitioners, gastroenterologists, different doctors about my bowel care, about my routine and how to manage it. And doctors are our best resources. If you're really struggling, and a lot of this stuff is not covered by the insurance and things like that. It's just out of pocket. They kind of give you advice on how to do it, but there are the things like we talked about, the Parastene, that are more viable solutions that stuff you can get through your insurance, possibly things like that. But it's okay to be like, hey, I need to talk to a gastroenterologist. I need to talk to a spinal cord injury doctor about this and get information right from the source, straight from the professionals, because sometimes medication and different things and information that we don't have, that only years of medical school and training can give you, are the solutions that make the difference, the ones that we need. So we talk a lot about managing it yourself, but get to a doctor too. Don't hesitate if you're thinking about it.
Definitely. And also, I was just going to mention that if you're going to try something and change something, make sure you just change one thing at a time. I know we've mentioned that before,
Yes.
but don't do too many. Don't throw too many changes at your body at once. If it's not, something's not working, adjust one thing, see how it works, and then adjust another.
Because not only you're going to have issues, but you're not going to know what's throwing you off if you're changing a bunch of stuff.
Also, when you make changes, particularly the medication and the supplies that you're using, keep your doctor in the loop. Let them know, hey, I'm going to make this change. Here's when I started, and this is what I'm doing, so that they can add that, to your medical history. We're going to try this. Because most doctors, if you keep them in the loop, they want to work with you. And
it's not always
important that they know.
it's not always fun to have to like reiterate, your last like 15 years of bowel management and how you've done it and the different things that you've done and different things that you tried every time you talk to a doctor, because that could get a little old. If the stuff is in your records and documented because you talked about it before, it can just make things a little more convenient, especially changing doctors and talking to different doctors and stuff.
Yeah, Peter down there in the comments makes a great thing where he says Coloplast will work with you. Coloplast and several of the companies.
Big shout out, yeah.
Yeah, they're a great resource as well, because
they
have
want to give you the stuff as much as you want it, and that's mostly because they want to sell it to you. But these individuals also understand the Mount Everest that we're all facing, which is our insurance system, and how impossible it is to get things, especially timely. So give a call to Coloplast, talk to a representative. They've sent me stuff before. They've given me tons of supplies, like at abilities expos and things like that. If it's a matter of getting like sample supplies and trying things out too, these companies will just take your address and send this stuff to you. And then if it works, you can chase that rabbit, with your insurance and be like, hey, they gave me this stuff. It's worked for 3 weeks. I could have a doctor, tell you that. Now that might be, the ammo that you needed to get it approved and to get the stuff that you need, for sure.
And that goes, with catheters as well. Another good piece of advice: go to support groups and ask other people. I mean, we're just 4 people here that, what's working for us, but go out there and get lots more opinions. Talk to your doctor. Watch for those signs. Maybe it is even, we didn't even touch on this, bladder infection. A bladder infection can throw you off so bad. I mean, with your stomach, with your poo, with, it can really throw off just any kind of infection to the body. So look into if it's something, a mild UTI.
Learning how other people manage their care. I mean, not want to be too funny here, but shout out Sean Fluke, our illustrious host and starter of Live to Roll. Learning about his routine, learning that he can manage his care independently at times and travel, and learning that he did his stuff every other day with some consistency and things like that was like, God damn it, Sean can do it. I can do it. and like I made that change, but it's only because I saw like a living, breathing example of someone who not only does it every day, but does it well, and like their body is healthy and like they're consistent. They live like their life and they're going out without issues and stuff. And but seeing that example gave me that push. If I did not have that example of someone doing it, an opportunity to talk to them about what they do and how they manage their care, I do not think I would have, made the changes that I've had and, like set myself up in the way, that I do that, I honestly can't really look at like going back on now, that I got there. So talk to other Crips. We're all pretty cool. More on here too, for sure. I'm more than happy to talk about this stuff. And it's hard stuff to talk about. So if that's a more private setting, more your MO, then don't hesitate.
Yeah, you can private message and stuff. That's fine. Keep it a little more personal. Not everybody wants to talk about it publicly out here. But one other thing I was just gonna mention too. I think it was it Peter that mentioned the digital stimulation, or Mason mentioned also digital stimulation also. I was going to mention that's one other thing that does help me as well. And then also on the Crede side, like you do, Luis, like I don't have full feeling and function like that, but I like we were mentioning, I get that like little AD feeling where I feel like it's coming, like I can know. And for me personally, when I push pressure like actually physically, that really tends to help me empty out better. Just like I just wanted to throw that last tip in there from earlier on just like
It's like,
also
Go ahead,
like a good massage where you come up and like a horseshoe, start on the right side, massage it up, come across, and then massage down also helps.
right.
Yeah, it's more difficult when you don't have that sensation and that core function, but it is possible. And I don't know if we have time today, but maybe on the next shit show, pardon my language, I don't want to get you demonetized.
Oh no, you're fine.
But we can talk about what's called hand manipulation, and that's where you press exteriorly. You take your hands, your fists, and press against your body. And you can also take your fist and put it behind your back and lean against the toilet. And those things will help you as you lower your hands down at a little bit at a time, and you rock back and forth. And it's a technique by which you can help move your stool
Also,
down.
like learning how to bear down even as a quadriplegic and stuff like that, like tensing your muscles and stuff. Like a lot of people think like we're, don't have too much control, but it's amazing how your body reacts and stuff. Given, the muscles that you do have, it's just you kind of got to learn to work with them for sure.
Exactly.
I did want to shout out real quick. Paul, I don't know if you're still with us, dude, but he mentioned that he had surgery, a suprapubic catheter surgery, and was having a hard time recovering, dude. We're just sending some love, man, hoping that the recovery and the infections go away. And thanks for coming back, dude. You just mentioned that he was away for a minute, so I want to shout him out.
Yeah, for sure. I saw that earlier too. Wanted to get to that, so thanks, Tom. Anything else? And I was just looking through. I think Cray mentioned earlier about the magic bullet and enemies. So we talked about both of those earlier on in the show, and they are both good. And I use magic bullet, and we've tried enemies and stuff. So
see you, Mason. Something Mason did mention earlier was the cost of like enemies. Magic bullets and enemies, they're usually a few dollars a pop. It's a few dollars every time you need to go to the bathroom. It's $13 every time I use a cath kit, throughout the day. It's like funny, our costs. Unfortunately, a lot of, at least I found, a lot of the bowel care, bowel prep stuff isn't covered by the insurance for whatever reason. How that's not the case is beyond me. But instead of talking about that, here are your solutions. Some of the stuff is affordable. I could get away when I was doing the enemies, like it'd be $100 for about a month's supply, which, it's $1,200 a year, which is a lot. I found that, I don't know, from support groups and stuff, that usually a lot of my wheelchair friends have tons of extra supplies. So I've gotten tons of extra enemies and magic bullets and stuff just given to me from people that use them, have them, don't use them, or through workman's comp or something else, like have an excess. So that your wheelchair community could be a really great resource to get some of these supplies if they're not in your budget, but you need to. There are also organizations and stuff that can help out. If you want to reach out personally, we can point you in the direction of some of those too to get some of those supplies, or at least get you some money, grants for those supplies. But yeah, the enemies and the magic bullets are generally the more affordable stuff. The stuff that I end up spending a ton of money on is just like chucks and wipes and supplies. Like fleet enemas aren't covered by insurance too, so they all come out of pocket. Amazon is my best friend for that. Like my apartment hates me because I get these big boxes of medical supplies, but I can buy, like 40 fleet enemas, for $20 on Amazon. Whereas if I do that at, CVS or Rite Aid or something, it's like, I'm paying at least double. So shop smart, shop effective. Amazon can be great for those kind of supplies. And if it's still not affordable for you, then reach out to us and we can help get you some of that stuff.
Yeah, definitely. And Triumph, like we always mention all the time, but Triumph on their website has an exchange program for people that have extra supplies to donate, and then for those people that need them, you can get those extra supplies. So there's probably others like that as well. But if you're in SoCal or really anywhere, for that, check out the Triumph
You guys are
website.
awesome. Thank you, everybody who comes back every week. We love you guys. Thanks for all our newbies that pop into. Everyone's amazing. Stay safe, stay happy, stay healthy out there.
Yes, thank you guys for watching. Please
Thanks,
be back
Luis,
next
for
week.
coming on today. Our illustrious guest, we appreciate it, man.
Thank you guys.
Thanks,
I love you guys. Love the
Love you,
comments. Comments are gold.
All right, everybody. We'll catch you guys next week and
Live to roll.